Joining us for this webinar hosted by the NHMRC Centre of Research Excellence on Achieving the Tobacco Endgame. I'm Coral Gardner and I'm the Director of this Centre of Research Excellence. Before we begin, I'd like to acknowledge the traditional owners of the lands on which the University of Queensland is located. These are the lands of the Jagera and Turrbal peoples, and I pay my respects to their ancestors and descendants who continue cultural and spiritual connections to country. I recognise their valuable contributions to Australian and global society and extend this acknowledgement and respect to all First Nations people who are joining us for this event. Internationally, this has been a big week in the field of tobacco control and public health, with world-leading tobacco endgame laws tabled in the New Zealand Parliament, which, if passed as expected, are likely to signal the beginning of the end of the tobacco smoking epidemic in Aotearoa. These policies include reducing the nicotine in cigarettes to very low levels, a radical reduction in the number of tobacco retail outlets, and phasing out tobacco sales to everyone born after a set year. This slide illustrates the immense health impact these policies could have on population health overall and also from an equity perspective. The solid lines show smoking prevalence for Maori and non-Maori men and women under a business as usual trajectory, and the dotted lines show the expected smoking prevalence if this suite of policies is enacted. This modelling study was led by our CRE researchers, Driss 8 Uakram and Tony Blakely, and was commissioned by the New Zealand Ministry of Health to inform their proposed tobacco endgame strategy. But the tobacco endgame is not just happening down under. A number of countries in the Northern Hemisphere are also working towards achieving a tobacco endgame. And today we're hearing about research from one of these countries, which is Ireland. Before I introduce our speakers, just some housekeeping. Microphones will be muted for the webinar, and so we ask that you place all your questions for our speakers in the Q&A function. So not in the chat function, but in the Q&A. And after the presentation, I'll try to put as many of these questions to our speakers as possible in the time available. Now, without further delay, I'd like to introduce Dr. Ellen Cosgrave. Dr. Cosgrave is a Specialist Registrar in Public Health Medicine with the Royal College of Physicians of Ireland, and she works at the Health Service Executive's Tobacco Free Ireland program, with Dr. Paul Kavanagh, who will be joining us for the Q&A session. Dr. Kavanagh is a specialist in public health medicine and the clinical lead of the Tobacco Free Ireland program. So we're very honoured to have these colleagues from the Northern Hemisphere joining us today. And I thank you, Ellen. I'll now stop sharing my slides so that you can then share yours. Thank you.
Thanks very much, Carol. I'll just share my screen now and then commence the presentation. So I'll just check that that looks okay to you there to begin. Great.
Yes, that's okay. It's all looking good.
Perfect. Great. Thanks very much. So good morning, everyone, or good evening in your case. And firstly, I'd just like to thank you for the opportunity to present my project today entitled Is the Public Ready for a Tobacco-Free Ireland? A national survey of knowledge and attitudes towards tobacco endgame in Ireland. So this project was carried out by myself, Dr. Ellen Cosgrave, in conjunction with Dr. Paul Kavanagh and the Tobacco Free Ireland team. And I'll begin by outlining some background, international and national context regarding the tobacco endgame, and then proceed to present the findings of our survey for your consideration. So tobacco-related harm is the leading cause of preventable death worldwide, contributing to 7.7 million deaths annually, 600,000 of which are due to secondhand smoking. In Ireland, tobacco-related harm causes over 4,500 deaths and leads to 44,000 hospital admissions annually. 1 in 2 people who smoke will die of smoking-related harm, and smoking reduces life expectancy by 10 years on average. Meanwhile, although Irish smoking prevalence has been steadily declining, smoking prevalence rose 1% between 2019 and 2021 to 18%, raising the question as to whether progress is beginning to stagnate. Looking at smoking prevalence in Ireland, as mentioned, in 2021, 18% of adults aged 15 and older smoked, 16% daily and 2% occasionally. This compares to a prevalence of 29% in 2007. Prevalence is highest amongst 45 to 54-year-olds, and this has recently reduced among the 25 to 34-year age group from 32% in 2015 to 20% in 2021. Prevalence is higher among males than females, and although smoking among both males and females has declined since 2015, there has been a greater relative decline among women. A social gradient is well recognised in smoking, and smoking prevalence is higher generally in deprived areas as compared to affluent areas. In fact, over 50% of the Irish health gap can be attributed to smoking-related harm. And in recent years, this socioeconomic gradient in smoking has widened from 16% versus 29% in 2015, comparing the highest and lowest socioeconomic groups, compared to 11% versus 31% in 2021. Looking then to Ireland's history with regards to tobacco control, Ireland has a strong history of tobacco control policy, as demonstrated by the early introduction of a number of key tobacco control strategies and legislative measures. Notably, Ireland was the first country worldwide to introduce a workplace smoking ban in 2004, and the first country in the EU to legislate for plain packaging in 2017. Ireland ratified the WHO Framework Convention on Tobacco Control in 2004, and other key tobacco control measures include the restriction on sale, removal of point-of-sale tobacco displays from 2009, requirement for graphic warnings on packaging since 2013, the EU Tobacco Product Directive legislation in 2014, and the introduction of a law restricting smoking in private vehicles, which made it an offence to smoke in any car carrying children in 2016. These measures are underpinned by strong legislation in the form of the Public Health Tobacco Act 2002 and the Public Health Tobacco Act with amendments 2004. More recently, while Ireland continues to align with the WHO, FCTC and Empower model, the EU Tobacco Products Directive has placed emphasis on regulating certain aspects of e-cigarettes, including minimum standards for safety and quality. While a recent report on the pre-legislative scrutiny of the Public Health Tobacco and Nicotine Inhaling Products Bill 2019 recommended a review on a potential Tobacco 21 policy, restriction of sales of e-cigarettes to those under 18, increased funding for cessation supports, prohibition of flavouring of e-cigarettes, and a licensing system for the sale of tobacco products and nicotine inhaling products. Efforts to tackle the harm caused by smoking have traditionally been framed as tobacco control, with the goal of reducing the impact on health. Ireland has made good progress with tobacco control, showing strong leadership with bold measures such as the workplace smoking ban. These efforts have translated into reduced smoking prevalence, and Ireland is now entering the late phases of the epidemic of tobacco-related harm. However, 1 in 5 Irish adults approximately still smoke, and tobacco is still sold despite its lethality when used as intended. It is clear there is a need to challenge social norms which continue to accept tobacco as a normal consumer product, and instead reframe tobacco as a harmful product, which if used as intended, leads to death for more than 1 in 2 users. In effect, there is a need to reframe goals from controlling the harm caused by smoking to eliminating it completely. In other words, we need to shift from tobacco control policy to the tobacco endgame. But what is tobacco endgame? Tobacco endgame is an ambitious concept which envisages a tobacco-free future involving policies, plans, and interventions aimed at ending the tobacco epidemic. Crucially, we must be clear on what we mean by the endgame and distinguish how endgame is not just an extension of current business as usual tobacco control measures, but involves the introduction of new innovative measures designed to bring the tobacco epidemic to an end. The endgame approach involves establishing a clear endpoint by a defined time, then planning backwards to ensure this is achieved. And the goal of tobacco endgame is distinct from tobacco control in that it seeks to change permanently the structural, political, and social dynamics that sustain the tobacco epidemic in order to end it by a specific time. What's more, tobacco endgame is not designed to divert resources from existing tobacco control measures. Rather, it seeks to build on implementation of the World Health Organization Framework Convention on Tobacco Control, while simultaneously introducing new, more progressive measures to accelerate the reduction of smoking prevalence to very low levels by a specific time. The Irish government committed to moving to tobacco endgame in 2013 with the introduction of current government policy, the Tobacco Free Ireland goal, which aimed to reduce smoking prevalence to less than 5% by 2025. However, as of 2022, this target is unlikely to be met, indicating the need for new, more radical tobacco endgame strategies to build on established business as usual tobacco control measures. As discussed in 2013, Ireland became one of a small number of countries adopting official endgame targets. So where does this target stand in relation to international counterparts? As demonstrated here in Table 1, similar to Sweden and New Zealand, the goal aims to reduce smoking prevalence to less than 5% by 2025. In comparison, then in Australia, your goal is to reduce prevalence to less than 5% by 2030, similar to Finland and the USA, while in Canada, this goal is set for 2035. So Tobacco Endgame seems to radically tackle the upstream supply of a harmful consumer product, which profits the tobacco industry, but if used as intended, kills over 1 in 2 users. Tobacco Endgame tactics can be classified into 4 themes: product-focused, which target tobacco product appeal and addictiveness; institutional structure-focused, which directly target tobacco industry production; user-focused, which target tobacco product affordability and access; and supply-focused, which target tobacco product availability and retailers. Table 2 here presents examples of proposed endgame tactics within each theme. Product-focused tactics include, for example, the proposal to reduce the nicotine content in tobacco products to very low levels, while institutional structure-focused tactics include increasing tobacco industry accountability for tobacco-related harm. User-focused tactics include increasing the minimum legal age of tobacco sales, while supply-focused tactics includes the proposal to phase out tobacco sales. Different tactics may be more appropriate depending on the unique national context and the needs of different populations. No one measure in isolation will achieve an endgame. The point is to pursue a range of new innovative and disruptive measures designed to drastically reduce smoking prevalence and which can help to achieve endgame synergistically. So a number of international studies have examined public support for endgame measures, and product-focused measures are among the most popular, particularly the proposal to significantly reduce the nicotine content in tobacco products so as to make them less addictive. This was supported in recent polls in New Zealand and the USA, for example. Supply-focused tactics have also garnered significant public support. For example, banning tobacco product sales near schools was very popular in England. Numerous countries have demonstrated public support for future planning aimed at eliminating tobacco product sales within a set timeframe, and in some cases, this was contingent on government assistance to help currently addicted smokers to quit. Reported public views on user-focused measures are varied. The Tobacco 21 policy has strong public support. A recent Irish poll found that almost 3/4 of those surveyed supported this measure. And this policy is also well supported in the US, Canada, England, New Zealand, and indeed also in Australia. The tobacco-free generation concept has drawn more mixed views, but still it is highly supported in New Zealand. In general, tactics that place greater responsibility on the tobacco industry for the harm caused by the products it sells are popular. This includes, for example, requiring tobacco companies to pay the state for costs accrued due to tobacco-related harm. So there are already examples of tobacco endgame tactics at various stages of implementation across the world. For example, as Carol mentioned, New Zealand have established itself as a pioneer in tobacco endgame with the recent release of the Smoke-Free Aotearoa 2025 Action Plan, which emphasised 4 endgame strategies: a reduction in the number of tobacco product sales outlets, lowering the nicotine content in cigarettes, gradually raising the legal age of sale for tobacco products to create a tobacco-free generation, all in tandem with increased investment in cessation supports. Other countries have introduced various elements of endgame policy to different degrees. Tobacco 21 is being implemented in the US, and tobacco product sales have been phased out successfully in 2 jurisdictions in California, Manhattan Beach and Beverly Hills, while the tobacco-free generation policy has been introduced by Brookline City Council. In Australia, e-cigarettes are limited to prescription-only access, and a reduction in tobacco product sales outlets was a policy objective in your latest preventative health strategy. Within Europe, Hungary adopted legislation in 2013, which reduced the number of retail outlets selling tobacco by 83%. The Netherlands have legislated to stop supermarkets from selling tobacco from 2024, and Finland has introduced laws banning government officials from meeting with tobacco industry officials, improving transparency regarding policy making. So Irish public opinion of tobacco endgame is comparatively largely uncharted to date, and it is well recognised that public support can be a key lever for realising policy change. Thus, the aim of our study was to measure awareness levels of and support for a tobacco-free Ireland in order to inform future tobacco endgame policy planning in Ireland. Objectives were to gauge support for measures that could be taken to achieve a tobacco-free Ireland, and to understand how people view the role of government and our health service in achieving a tobacco-free Ireland. This was a cross-sectional study which involved the telephone delivery of a literature-informed survey instrument to 1,000 members of the public aged 15 and older. Recruitment and data collection were carried out by an external market research company in February 2022 as part of an omnibus survey. Data were then transferred to the health service and reweighted and analysed using SPSF software. Prior to study commencement, ethical approval was granted by the Royal College of Physicians of Ireland. In terms of results, here you can see an overview of the demographic profile of participants. Of the 1,000 respondents interviewed, the majority were aged between 18 and 44 years, belonged to social class C2 or below, and had reached third level education. Approximately 1 in 5 or 19% currently use tobacco products. In terms of the Tobacco-Free Ireland goal awareness and support, although awareness for the goal was low at 1 in 3 or 34%, 3/4 of participants supported the Tobacco-Free Ireland goal. Similarly, a very high proportion, or 77%, believed that the goal was achievable. However, only 17%, or approximately 1 in 5, believed that the goal was achievable by 2025. Here you can see a breakdown of goal awareness and support by tobacco product use status. Although tobacco product users were more likely to be aware of the goal than non-tobacco product users, they were less likely to support the Tobacco-Free Ireland goal. However, that said, over half of tobacco product users did support the Tobacco-Free Ireland goal. As anticipated, there was variation in support for the Tobacco-Free Ireland goal across various population subgroups. For example, compared to males, females were 57% more likely to support the goal, and compared to those of lower social class, those of higher social class were 72% more likely to support the goal. Interestingly, awareness of the Tobacco-Free Ireland goal was not significantly associated with increased goal support. And compared to tobacco product users, non-tobacco product users were 2.7 times more likely to support the Tobacco-Free Ireland goal. Although 77% believed that the Tobacco-Free Ireland goal was achievable, only 1 in 5 believed the goal was achievable by 2025, the current target. Instead, the majority belief was that the goal was perhaps more achievable between 2026 and 2035. Meanwhile, over 3/4 of respondents believe that the government should do more to protect the public from tobacco-related harm, while less than half believe the HSE, our National Health Service, was doing enough to tackle the harm done by smoking, or that the government was doing enough to achieve the Tobacco-Free Ireland goal. Looking then at support for component tobacco endgame measures, in terms of product-focused measures, extremely high support was evident for lowering the nicotine content in cigarettes and e-cigarettes to make these products less addictive. Both measures were supported by 86%, or more than 4 in 5 respondents. Similarly, very high support was evident for tighter regulation of tobacco products at 79%. 7 in 10 also supported a ban on added chemicals to make cigarettes more difficult to tolerate, while over 6 in 10 supported requiring individual health warnings to be printed on all individual cigarette sticks. The majority also supported banning filters on cigarettes to make the products more difficult to tolerate. In terms of institutional structure endgame measures, approximately 4 in 5 respondents supported requiring tobacco companies to pay the state for health costs due to the harm caused by tobacco products. The majority also supported banning representatives linked to the tobacco industry from meeting with government officials. In regards to user-focused measures, there was very high support for banning tobacco product sales near playgrounds, schools, and universities. Approximately 4 in 5 respondents supported this measure, while support for raising the legal age of purchasing tobacco to 21 years was very high at 71%. Approximately 6 in 10 supported a ban on smoking tobacco products in public places, increasing the tax on tobacco products by 20% a year until less than 5% of people smoke, and preventing everyone who's currently under 18 from ever buying tobacco products for the rest of their lives, or in other words, a tobacco-free generation policy. Support for requiring people to hold an official license to buy tobacco products was more mixed at 40%. In regards to supply-focused measures, very high support was evident for phasing out sales of tobacco products. 83% of respondents supported this measure. Similarly, support was seen for requiring shops selling tobacco products to display information encouraging users to quit at 82%. Approximately 6 in 10 respondents supported restricting e-cigarette sales to over-the-counter sales through pharmacies only, and supported allowing tobacco product sales in a limited number of specially licensed shops only, and for reducing the number of places that can sell tobacco products by 95%. Half of respondents supported restricting tobacco product sales to restricted hours of the day, while more mixed support was evident for requiring people working in shops selling tobacco to undergo training, enabling them to provide quitting advice to tobacco users, and for restricting e-cigarette sales to prescription-only access, as is already in place there in Australia. So here you can see how, while 83% supported a complete phase out of legal tobacco sales, for 70% of all those surveyed, support for a phase out was dependent on supports for current smokers, either government assistance to help smokers to quit or enabling current smokers to continue to buy tobacco products using a license, or both. So to summarise our main findings, there was majority support for 18 of the 22 measures assessed, and average support was highest for measures focused on tobacco product regulation, while views on user-focused measures were more mixed. Support for a complete phase-out of legal tobacco sales was very strong at 83%, and 2/3 of supporters believed this should occur within the next 10 years. Meanwhile, for 70% of those surveyed, a phase-out was contingent on increased supports for people currently addicted. Other very highly supported measures included reducing the nicotine content in tobacco products, requiring tobacco retailers to display information encouraging users to quit, tighter tobacco product regulation, banning sales near playgrounds, schools and universities, requiring tobacco companies to cover health costs accrued due to tobacco-related harm, and raising the minimum legal age for tobacco sales to 21 years. So this study has identified high levels of Irish public support for tobacco endgame and component endgame measures, especially in relation to product-focused measures. What's more, the majority surveyed believed that endgame was achievable. However, most believed this was more realistic between 2026 and 2035. Key finding was the fact that public support for endgame measures is largely contingent on supports for those currently addicted, indicating how the public want assurances that currently addicted smokers, particularly those in vulnerable population subgroups, are not left behind. Variation in support for the Tobacco Free Ireland goal was evident among people who use tobacco products, males and those of lower social class, and this highlights the need for targeted endgame approaches to inform equitable endgame policy planning. And indeed, the recognition of the needs of currently addicted tobacco product users should be integral to tobacco endgame planning. Interestingly, the public believed that the government and our health service should do more to tackle tobacco-related harm, and the majority did not believe enough was being done by government to achieve a Tobacco Free Ireland. Lastly, it is clear that public awareness of the Tobacco Free Ireland goal itself could be improved. So this study confirmed how the Irish public are ready for more progressive tobacco endgame measures to end the tobacco epidemic. However, to achieve endgame, priorities include the need for more radical product-focused tobacco endgame measures, including regulating nicotine content to make tobacco products less addictive, upward adjustment of the abolition of tobacco product sales to young people, restriction of the tobacco retail environment in a way which is more proportionate to the lethal nature of tobacco products, and increased tobacco industry accountability for tobacco-related harm. Key considerations for tobacco endgame policy planning in Ireland include the need to harness public support for Tobacco Free Ireland and to denormalise acceptance of the continuing harm caused by tobacco in Irish society. Endgame planning should take account of the needs of population groups most impacted by tobacco-related harm, so as to ensure that health inequalities are not exacerbated. And in effect, as we progress towards the tobacco endgame, equitable policy planning and implementation is vital. So it's now been 18 years since the introduction of the workplace smoking ban in Ireland, which was a seemingly impossible step prior to 2004, but which now represents a major success story for Ireland in global tobacco control. Children born in 2004 are now adults. However, in 2022, the tobacco industry continues to profit from a product which kills more than 1 in 2 users if used as intended. Now in 2022, the Irish public have answered the question, is simply controlling the harm caused by tobacco still a sufficient goal, or should we now aim to end it completely? In conclusion, this study has demonstrated an overwhelming reservoir of Irish public support for tobacco endgame, how the Irish public believe that endgame is achievable, and how they want a tobacco-free future for the next generation. They are ready for new, bold and ambitious tobacco endgame measures to achieve a tobacco-free Ireland, and a key priority of Irish public support is ensuring currently addicted users are not left behind. There is a need for renewed political commitment and urgent bold action based on what the public has said in this survey. And now is the time to take the final steps towards ending tobacco-related harm for once and for all and achieve a tobacco-free Ireland. But what relevance does this have to the Australian context? Well, both countries are historical leaders in tobacco control. For example, Australia pioneered plain packaging, while Ireland were the first to introduce a workplace smoking ban. Both were early adopters of official endgame targets, and both have seen a steady decline in smoking prevalence, albeit with variation in population subgroups, with residual high prevalence among minority groups and those of lower social class. Both have recognised the need for a focus on equitable tobacco endgame policy planning so as not to widen pre-existing health inequalities. And lastly, both countries have adopted a similarly cautious stance on e-cigarettes, with a strong focus on the unknown long-term effects of e-cigarettes and the resultant need for e-cigarette regulation, in line with the WHO, who have advised that new and emerging products such as e-cigarettes should be included in a comprehensive approach to tobacco control. So in terms of translatable learnings, the Irish public have answered the question, is simply controlling the harm caused by smoking still a sufficient goal, or should we now aim to end it completely? When presented with bold measures needed to achieve endgame, the Irish public support was high. And finally, as we progress the endgame agenda, the Irish public want assurances that currently addicted smokers and vulnerable population subgroups will be supported. In effect, the Irish public want to bring tobacco-related harm to an end, leaving nobody behind. So I'd like to thank the following for their input into the survey design and data collection. Here are my references. And thank you very much for listening.
Thank you so much, Ellen. That was a lovely presentation. And I'd like to throw some questions to you. So if you want to turn off your screen sharing. One of the things that I really liked about your survey is that you measured support for a range of different policies all in the one survey. So most of the research that's been done so far has asked about support for one goal, the goal overall, or one or two policies and so on. But you actually were able to collect those views across quite a range of policies. Were there any results that surprised you at all in what you found?
I think overall, perhaps the biggest surprise was how high the support was for a large range of measures. So, for 18 of the 22 measures that we assessed, there was majority support and very high support for some measures, in excess of 80%. And for even, some of the highly supported measures were perhaps the more progressive measures rather than, such as a phase out of tobacco sales. That was extremely highly supported. I think we perhaps anticipated that maybe user-focused measures would garner less support in general. And for example, the result maybe that stood out was that there was lower support for a license for tobacco product users. But I think that was in keeping with the literature we had reviewed prior to undertaking the study. So I don't think there really was anything that stood out as maybe unanticipated, other than perhaps the relative level of support being quite high generally.
Yeah, so I think you had, was it 71% support for the tobacco 21 policy, but then 83% for a full phase out. So it just goes to show that I guess the public is sometimes ahead of where we think they are in terms of what they think is appropriate for tobacco control. So I guess the other thing was, there is this fairly high level of support for an endgame goal, though there was low awareness of the Tobacco-Free Ireland goal. Was there any public education campaigns to educate the public about the Tobacco-Free Ireland goal ahead of this survey? Is this something that's been any active attempt to make people aware of this goal?
So as far as I'm aware, there hasn't been any kind of substantial coordinated campaign to raise awareness of this goal. And I do believe that that is definitely needed in Ireland. I think that was a major, it was, a striking finding within the survey. Only a third were aware of the goal. And I think, public awareness is key really to building momentum and building a platform to advocate for the goal. So there is a lot of work, I think, to be done. New Zealand recently examined the same question, the awareness for their goal, back in 2018, and awareness among smokers in New Zealand was as high as 95%. So I think we have a long way to go in terms of raising public awareness.
So I've got a question here from Claire. I'm curious about any reflections Ellen may have on the choice of terms such as tobacco-free, smoke-free, and so on in the era of e-cigarettes. So for some, this will be understood to also include e-cigarettes, but for others, not so much. So did you have any thoughts about the wording that is used?
Yeah, we thought about this quite carefully because I think, it's fundamental really to what we're measuring within the survey. And I think even within the literature, it is contentious whether e-cigarettes should be included under the bracket of tobacco products. So for the purpose of this survey, we did include e-cigarettes within that term. The rationale being that for nicotine containing e-cigarettes, nicotine is derived from tobacco. But I do understand that, international literature can diverge on that topic, but we actually did provide clarification for participants on that exact point, just so that things were clear from the outset. Yeah.
Yes, and so we've got another question about, do you foresee any challenges in getting policymakers on board to consider implementing some of these policies?
Yes, I do think it will be challenging. I think, this is just one facet of the process of trying to implement these measures. And we've identified high public support, but I think really now the key is to generate decision maker buy-in and support. And I think there will be diverging public views on some of these measures, particularly, in the past there's been diverging views on tax measures, on retail restrictions, on particularly, I guess, user restrictions are probably the most contentious of measures. But I do think it's a good first step. It's a good evidence base with which to kind of ground our advocacy for implementing the Endgame.
So that's probably a great way for me to segue into my next question, which is about, what are your plans about continuing this discussion with the public about tobacco Endgame policies? Are there any planned information campaigns or anything like that in the pipeline?
I might direct this one maybe to Paul.
Yeah, so definitely from our point of view, this piece of work was about opening a conversation and bringing the public into the conversation around tobacco Endgame, because while those of us who work in public health have identified this as a goal, I think realizing that goal is really dependent on involving the public. So that's why we did this piece of work. We see it as the start of a continuing conversation. And to some of the earlier points and questions around levels of awareness, we're in the process at the moment of developing our new mass media campaign. We tend to refresh our mass media campaigns once every 2 to 3 years, and we've had a discussion about if and how and when we will weave in the tobacco Endgame idea into those mass media campaigns. I think it was interesting, as Ellen identified, that public support for some of the component tactics to deliver an Endgame wasn't actually dependent on public awareness for the goal. And this was the first time that we went out to the public and asked them about measures which almost by definition are at the margin of what we might consider to be possible or achievable in terms of work on reducing the harm caused by tobacco. So I think the fact that so many people in the public were supportive of these component tactics, while when presented with the goal of a tobacco-free Ireland, perhaps the awareness was less high. I think it still shows that there's a huge reservoir of public support in terms of this work. And certainly from our point of view, building on that, continuing the dialogue. And I think to the earlier question, bringing our political leaders into that dialogue as well, by demonstrating to them that there's a high degree of public support. These for us are really key steps forward in terms of trying to deliver a tobacco endgame in Ireland.
Yeah, that's excellent. So this has been a really exciting presentation for us, and we've really enjoyed it. So thank you again so much for joining us, and for also staying on for a few more minutes for a few questions. So thanks again.
Thank you.
Thank you very much for the opportunity to present our findings and to collaborate today. Thank you.
Thank you.
Thanks.